Hello, welcome back to another video. This is Dr. Jacob Lilly with Enhanced Chiropractic Relief, and today we're going to be talking about the comparison between a low-fat diet versus a low-carb diet and its effects on weight loss. Now, according to the WHO, the World Health Organization, they've put together the data and they've reported that obesity has tripled since 1975. Adding on top of that, the reports are to show that diabetes in combination with obesity is expected to rise by 51% by the year 2045. So you can see how this is becoming an ever increasingly worse problem as time is going by. So we're going to talk about two styles of diets, low carb versus low fat, in terms of how it can decrease the levels of obesity in terms of weight loss, and how that can further decrease the chances of these obesity related disorders such as diabetes, cardiovascular disease, and things like that. And today we're going to be discussing a meta-analysis that took a bunch of randomized controlled trials analyzing the effects of a low carb versus a low fat diet and its implication on weight loss, as well as cardiovascular disease, but we're going to hold off on that and just focus on the weight loss. Now, when looking at this study, the way that they classified low carb versus low fat diets is that if the low carb diet was less than 40% of total macronutrient profile in a diet. So if you're eating less than 40% of carbs, according to the study and what they've looked at in the research, they consider that a low carbohydrate diet. So again, less than 40% of the total macronutrient profile, which means 60% is left over for protein and fats. Now conversely, if we're looking at the low fat diet, they're looking at less than 30% of the total macronutrient profile in your daily diet is attributed to fats. So that means the other 70% of what you're eating throughout the day is attributed to proteins and carbohydrates. They didn't quite specify the remainder ratio. So if it was like, let's say for the low fat diet, if it was a 30%, less than 30% of fats, 70% left over. They did not specify whether it was 60% protein and 10% carbs, or if it was split, evenly. They did not specify that, however. So that's one thing to keep in mind. So again, this meta-analysis primarily looked at weight loss in terms of actual body weight or body mass in terms of kilograms. They looked at BMI, which again isn't the best metric in terms of overall body composition. There's a few factors that need to be adjusted for that, but they did look at that metric. They also looked at HDL and LDL as well as triglyceride amounts, which all have certain implications in terms of cardiovascular disease. Like I said, this study looked at weight loss as well as cardiovascular disease factors in terms of what's the difference between a low fat and a low carb diet. But for the sake of this video, we're going to gently kind of put away the cardiovascular disease profiles until maybe the very end and focus primarily on the weight loss aspect of this meta-analysis. So again, this meta-analysis took a look at various randomized controlled trials, and what they found was that 19 of these actually tracked caloric restrictions with each participant. And that's a big thing because, again, when it comes to any sort of weight loss, we want to have that energy balance kept in mind. We want to understand how many calories are being consumed versus how many are being expended or burned in a sense. So that's very important. 19 of these studies showed caloric restrictions as a part of the weight loss program. Now, with all that said and done, very interesting things happened in terms of the results of what they found through all of these studies. Strictly in terms of weight loss, they found that there was greater adherence and greater effect with the low carbohydrate diet, meaning it's a little bit higher fat content in each diet. It's not necessarily specifying a ketogenic diet or something similar. It's just, again, a very general and very broad sense of a high fat diet, or in this case, a low carbohydrate diet. So what they found was there was greater adherence as well as weight loss. What they found was at 6 to 12 months, the low carbohydrate diet, so again, less than 40% of total carbs in your macronutrient profile, was shown to be statistically better than the low-fat diet at 6 to 12 months. Conversely, 1 to 3 months, so the first 3 months of you, let's say, changing your diet to either a low-carb diet or a low-fat diet, they found really no statistical difference in terms of those two. But they did find weight loss in both, which is important. And ultimately what they found after 12 months, so after a year, was that there was no statistical difference once again. Now, this can point more towards low or no adherence, as well as later they talked about physiological adaptations to these diets. Now, we can talk a little bit about that afterwards, but ultimately they found that after a year, they achieved the most return on what they were doing, or what they were setting out to do. In this case was weight loss results. So they gave a time frame of 1 to 3 months, 6 to 12 months, as well as greater than 12 months. And again, just to reiterate, they found that that middle portion, low carbohydrate diet, has a greater statistical benefit in terms of weight loss and overall weight reduction versus the low fat diet at 6 to 12 months. Anything less and greater than that, there's been no statistical difference. Now, that I would further speculate in saying that the low-fat diet and the higher carb diet might take a little bit longer in terms of reaching that overall weight loss goal. Okay, so that's one thing to keep in mind. It seems that the low carbohydrate and higher fat diet, so in this case possibly a ketogenic diet, would be a little bit quicker in terms of weight loss. That is just looking at specifically weight loss. Now, this meta-analysis also talked about its reduction in cardiovascular disease risk factors, such as higher LDL content in our body. Now, they looked at HDL, which is a good type of molecule that we look at in terms of cardiovascular disease. So if we have higher amounts of HDL, that tends to be a good thing. If we have higher amounts of LDL, that tends to be a bad thing. And they also look at triglyceride count. What they found was with the low carbohydrate diet and higher fat content diet, so again, just think about maybe possibly a ketogenic diet in this case, they found that the numbers were a little bit better in terms of higher HDL, lower LDL, so lower of the bad cholesterol, as well as a better triglyceride count. Okay, so overall a little bit healthier. Now, the reason why they say that it's better in the short term is because when you're basically consuming less carbohydrates, so again, a low carb diet, higher fat content diet, you're going to experience a lot of physiological changes. Okay? Some of these changes that they noted was decreased insulin sensitivity, which is very important in people who are diabetic, where they have insulin insensitivity, meaning that whenever they consume carbs, it stays in the blood because their insulin and the pancreas is affected in some way that it can't secrete the insulin to shuttle that glucose and that sugar out of the blood into the muscles and other parts of the body. So this basically has shown that a higher fat diet and a lower carbohydrate diet has been shown to improve upon that. So again, to conclude everything and kind of sum up everything that this meta-analysis pointed us towards, so again, we're comparing a low fat versus a low carbohydrate diet. Now, in terms of just general weight loss, they both work. Again, the important thing in terms of just strictly weight loss is the energy balance between calories. So how much you're consuming versus how much you're expending. Okay, so that's again the main fundamental point in terms of weight loss. Now, if you're looking at what statistically might be a little bit better, the low carbohydrate diet and the higher fat content diet, so in this case again we can kind of think of a ketogenic style diet, seems to work a little bit better in terms of 6 to 12 months. Okay, so if you're going to adhere to this diet anywhere from 6 to 12 months, you statistically, according to this meta-analysis, will have a better chance at losing more weight than a low fat or higher carbohydrate diet. Now, personally, what I would recommend is pick one or the other and stick with it for that 6 to 12 month range. Okay, that's the important thing. The most important thing when choosing a diet is actually the adherence and how disciplined and how easy you are to follow it and basically replicate those results over and over and over and over again. Because if you're going through this style of yo-yo dieting where you do, low carb for a month, it works, and then you get tired, you fall off of it, and then you do a low fat diet because you think that's the answer. Then you do low carb again, and then low fat, and then you're just going back and forth. That's not going to work. Okay, that's actually going to possibly make things worse. Low carb versus low fat diet, pick one. Doesn't matter primarily which one. They both work, but just remember that energy balance of calories in versus calories out is going to be the biggest and most influential factor in terms of overall weight loss, as well as time and patience. Okay? The more patient you are, the more disciplined you are, the more likely that you are going to adhere to this plan, whichever one that you choose. You're going to end up having those results a lot faster and a lot more efficient and safely in that case, and you will experience results. It's as simple as that. Okay? Similar with weight training, similar with anything that's usually going to be important to you, it takes time. And the most important thing is you are disciplined with your time, you're taking it seriously.